A loose or damaged filling can allow gaps to form between the restoration and the tooth, requiring professional evaluation. A dental professional first evaluates the condition of the existing filling and the surrounding tooth structure. A damaged or loose filling may no longer seal the tooth properly, making professional replacement necessary in some cases. The damaged restoration is carefully removed while preserving healthy tooth structure whenever possible. After the old filling is removed, the tooth is carefully cleaned and prepared for a new restoration. A new tooth-colored restorative material may then be placed to rebuild the treated area. The restoration is carefully shaped to recreate the tooth's natural contours and chewing surface. The completed restoration is finished, polished, and carefully checked for a natural fit and appearance. Replacing a loose filling may restore the tooth function and appearance when recommended by a dental professional. This video is for general education only. If you have a loose or damaged filling, consult a qualified dental professional for evaluation and treatment.